Hey guys, welcome back to my channel. My name is Kate Santana. I am a wife and a mom of 2-year-olds, Olivia Joy, and I am 29 weeks pregnant with baby Eden Elizabeth. As you can tell by today's title, I am going to be talking to you about ways that you can prepare to have a easier, natural labor. I am a teacher by profession, so I have all of my notes here. It is sectioned out for you, so I'm just gonna briefly give you an overview of what I'm gonna talk about, and then we're gonna jump right in. So number one, I'm gonna talk about why you need to prepare. Number two, how to educate yourself, what you need to educate yourself on and why it's so important to educate yourself. Number three, the need for making a firm decision and everything that comes along with that when it comes to your labor and birth plans. Number four, understanding what you are up against when it comes to desiring a natural labor. Number five, I'm gonna be talking about preparing your mind. And number six, I'm gonna be talking about preparing your body. And then I have some bonus tips at the end if you stick around for that. If you enjoy this type of content, please don't forget to hit that subscribe button and go ahead and like and comment on this video as well. Great, so why do you need to prepare for childbirth? Well, this will most likely be one of the most, if not the most, intense physical experiences of your entire life. If you were to run a marathon, for instance, or do a really long, like open water swim, you would absolutely train for it. You would know exactly what is going to happen in each part of the race or the swim or whatever, and you would be prepared to make it to the finish line. You want to do the exact same thing with birth. As you've probably already heard from other mamas, labors can and do vary wildly. Some of that is out of our control, but some of it is absolutely within your control. You want to do everything that you can to give yourself the best possible chance of a positive birth story. And so that is why we prepare, to do our part to make sure that as much as it is up to us, we are ready and we are preparing our bodies and our minds for a beautiful birthing experience and not a traumatizing one. So number two, educating yourself. Now that you know you need to be prepared, how do you prepare yourself? The number one thing I would say you need to get started with right away is preparing yourself to understand labor and delivery in depth. For every detail that you understand in birth, you are that much more prepared to make informed decisions and to resist the temptation for unnecessary interventions. I'm talking knowing ahead of time, even in the third trimester, what are appropriate interventions. Knowing about things like induction in case your doctor decides to bring that up. What are some natural ways that you can induce labor? Knowing about things like the fact that getting ultrasounds in your third trimester to predict the weight of your baby can actually lead to more C-sections because those weight estimates are wildly inaccurate and can oftentimes scare a mom into thinking she won't be able to deliver vaginally when she absolutely will. I know stories just of people that I personally know who were told they have a 9-10 pound baby and the baby came out 7 pounds. So those are all the types of things I'm talking about as far as researching labor. That's even before labor. Then you get into labor. What are the signs of early labor? What's happening in early labor? How long does it normally last? What can cause it to slow down? What can cause it to speed up? You want to research all of these things. Once you get into active labor, what is that like? What is transition like? What is pushing like? What is delivering the placenta like? All of that, you need to educate yourself on the birth process in depth. Why does this matter? I'll give you one personal example, although I do have several. I thought that I was very well prepared, and in fact, in a lot of ways, I was well prepared for birth. But one thing I really wasn't ready for or did not research enough was the fact that I could be at 10 centimeters and not be ready to push. And that's exactly what happened, is that I was at 10 centimeters. The PA told me, oh, couple pushes and the baby will be out. The midwife got there and I was like, I don't even know how to push. I don't feel like I have to push. And I pushed for 2.5 hours. If anything was traumatizing from my first birth, it was pushing. I felt like I wasn't gonna make it. It was that moment where I really felt like I wanted to quit. And a lot of it was because my body was not telling me to push, but I didn't know to wait for those feelings of the urge to push, and so I just pushed when I didn't really need to. There is something called laboring down, where I just continue to labor even though I'm 10 centimeters until the baby drops low enough where I feel the urge to push, and I just was not aware of that. If I was, I could have made different decisions. I could have told the midwife or the PA, I really don't want to push right now. I want to just continue to labor, and my birth could have looked different. So you want to educate yourself as much as possible. It really does make a difference in the moment on the decisions that you end up making. Along with understanding the natural process, you want to research possible interventions, at least the most common ones, and what are their pros and what are their cons. So things I'm thinking about are like epidurals, Pitocin, Cytotec, other methods of induction, even interventions like getting an IV. So this was another thing that I had not researched really enough. I was throwing up once I started active labor with Olivia at home. I went into my midwife's office. She saw me, she said, are you able to keep anything down? I said no. That wasn't that specific of a question, which I'll get to in just a second. So she said, I'm gonna send you to the hospital and put you on an IV, which in itself, you know, you feel cared for. Like, she doesn't want me to get dehydrated. The problem is that the IV puffed me full of water, and this is TMI, just to warn you, but the midwife told me after I had delivered Olivia and she came in to visit us, I knew you were gonna tear because you were just so swollen as soon as I came into the room. And I was swollen because of the IV. I also, I have pictures, maybe I'll insert one even though it's so embarrassing. Like, my face was just so swollen after birth because the IV had put too much liquid back in my body. I had basically stopped throwing up. I really didn't throw up like that much anyway that I was at risk for dehydration, but I had stopped throwing up and had started eating ice chips and things like that. So I was replenishing my body on top of the IV, so it was just too much liquid in my body. Those are the types of things that it's good to think about ahead of time if you can. My midwife this time around, I asked her, what will you do if I'm throwing up? You know, do you do an IV at home? She was the one that actually told me an IV is not a good idea because you're gonna get swollen. Like, if you can keep water down for at least 10 minutes before throwing up again, the water has gone where it needs to in your body and you're fine. So if you're taking little sips or you're able to eat ice, you don't need an IV. Research would have helped me to possibly tear less if I had known that ahead of time. Another really good place to start when it comes to researching and educating yourself, read up on the difference between a midwifery model of birth and a medical model of birth. I'm not gonna get into it here because I think it's really important that you just read it on your own, but there is a huge difference in the number of interventions and in the trust that they have for a laboring mother. I would say in your research, and I will link a bunch of websites and books that I suggest down below, dig deeper than just like WebMD or typical medical websites. It's okay to look at some medical websites, obviously, but oftentimes they spin things in a different way. Just for instance, I read an article about home birth being like super dangerous, and it was on one of these medical websites. And then the last sentence in the article said, and lastly, like, home births deprive women of epidurals. And I thought to myself, deprive women. Like, that's an interesting way to put that. I'm pretty sure I'm reading a biased article right now. So you want to be careful how you're getting your information. I absolutely suggest reading some information on midwife websites as well as possibly European websites or other countries that have a much higher rate of natural birth. America is the worst when it comes to birth and birth outcomes, so you want to steer clear of American medical websites when it comes to finding your information. Okay, with all that being said, after your research, you need to make a firm decision about wanting a natural birth if that is what you want. If you want an epidural, then by all means, go ahead and make that decision. But if you want a natural birth, I highly encourage you to not say, I'm going to try to do this, but to make up in your mind without a plan B, without any option to change your mind, that you are not going to get an epidural. I say this knowing from personal experience, hearing a lot of people say, I'm gonna try to have an epidural, and I'm not trying to be mean, this is just anecdotal data that I have collected. Every single one of those people has ended up with an epidural. You need to be settled in your mind that there is no other way that you are gonna give birth, that you absolutely can do this. If you feel like you're not there yet, I highly suggest working through your fears in an active way. Talk to friends, talk to a midwife, talk to a doula, talk to another birth professional that's used to seeing natural birth. pray about it if you are a believer, read scripture, talk to friends that have had natural births, go on Instagram and find people who've had natural births. I have done this even with home births and be like, hey, I am gonna have a home birth. I saw you just did. I'm nervous. What can you tell me? Like, I have actively worked through my home birth fears recently within the past month to the point where my fear is essentially gone right now, and it was pretty heightened in the beginning. So you can absolutely work through your fear. That's number one. Number two is to change your thought patterns and to be really intentional about that. So you can do birthing affirmations on your own, or you can do this course called Hypnobabies, which I am doing this time around, that actually provides you with affirmations. I'll probably do a separate video on Hypnobabies because it's too much to get into here, but they're teaching you how to reprogram your mind to believe that birth is safe, it is enjoyable, it is a wonderful experience for you and your baby. And not only that, but Hypnobabies also goes through all of like this birth education that I've been talking to you about. What happens during labor, what happens during pushing, how can you talk to your doctor to make sure that they are supportive of your natural birthing decisions. So I highly recommend Hypnobabies. I was actually able to get my insurance to pay for it, so I would go ahead and check that out. I'm gonna link it down below for you guys as well. Along with affirmations, listen to positive birth stories as much as you possibly can. It makes a difference. And stop anyone who is telling you a negative birth story, or turn off the news, or stop that video that you clicked on. Like, be really intentional about stopping stories that are going to induce fear and in consuming stories that are going to give you the faith to believe that you can absolutely have a natural birth. And last, I know I already said this, but do not entertain thoughts of a plan B. There is no plan B. You can absolutely do it. I can say for certain with Olivia, there was never ever a point where I thought there is even a small chance that I can get an epidural. I just felt like it wasn't even an option for me. It wasn't something I was ever gonna consider, and that helped me mentally a lot to make it through the labor, knowing like, this is how my labor is gonna go. This isn't an option, it's not on the table. I'm gonna work through this naturally, and I was able to do so. Okay, number 4, understand at least to some extent what you're gonna be up against if you have made that firm decision not to have an epidural. Now, I'm not really speaking to mamas who have decided on a home birth, a birth center, or who are with a practice that is very used to natural birth. I'm talking more to mamas who are with an OB where the majority of their patients end up with epidurals, or you are delivering in a hospital where epidurals are the norm. You're going to want to understand that the doctors and the nurses and the PAs and everyone there is not used to a laboring mother declining an epidural, and that is going to present some challenges, some of which I've talked about in previous videos. Just even like my sister's last experience, my mom's last experience, they basically were not trusted as birthing mothers, and that is sadly what you need to prepare yourself for as a worst case scenario, that you will not be trusted as a birthing mother, and that they will try to convince you that they know better for you than you know for you. Which is, again, back to number 3, why you need to make sure you've made that very firm decision in your own mind that you cannot be swayed from, that you will not waver from, because there's a chance that these birth professionals, as well intended as they may be, may try to convince you that you need some of these interventions. One tip I have is to tell your husband or your birth partner that they need to intervene on your behalf, and that the doctor or the nurse or whoever should speak to them. They can speak to them very kindly and whatever, but you can stay in your own bubble where no one is talking to you or pressuring you or anything. There should be this in-between person of your birth partner who is kind of taking the hits as far as like, oh, maybe she needs an epidural now, or whatever they're gonna say. You want your birthing partner to be the one dealing with that and not you. Last thing I will say about this part, actually, no, 2 things. Learn the common rationale that they're gonna give for pushing you for an intervention, and learn what the rebuttal is. So again, like I talked about before with my IV, that was something that I didn't know, but they could try to tell me that I need an IV because I'm gonna be dehydrated, but the rebuttal would be, well, I'm just gonna take small sips of water in between throwing up, and like, unless I actually show signs of dehydration, I don't want an IV. And lastly, change providers if necessary, and hire a doula if you can't change providers. So I changed my OB at about 14 weeks with Olivia to an OB midwife team that was going to be way more supportive of natural birth. It was honestly one of the best decisions I have ever made. I am so glad that we switched. And then with this pregnancy, I started at that same place that I delivered with Olivia, but then we moved. I found a new provider here, and after some warning signs at about 23 weeks, I decided to switch to a midwife and a home birth, and I am so glad that I did. So do not be afraid to switch providers if there's still time to do so. If there's not, I suggest hiring a doula. I know it's an extra cost, but it is so worth it. They will advocate for you, and they will greatly increase the chance that you can have a natural birth. So know what you're up against. It's not impossible, but you need to just be realistic about the help that you might need, whether that's a doula, whether that's changing your provider, or just whether that is being armed with information that you can combat these suggestions for intervention with the information that you have to show that you are super educated and you're not gonna be like bullied into an intervention. Okay guys, you're sticking with me here. Just 2 more. So prepping your mind. First thing I did as a believer with Olivia, as soon as my 3rd trimester hit, and not that I wasn't doing this before, but I was super on top of it, was prayer and journaling all the time. Every day getting in my chair, praying and journaling over the birth that I wanted. Not only did those prayers petition heaven on my behalf, but they also set my mind on the things that I desired. I did not focus my prayers on fear, but on the faith that things were going to go well, which is part of preparing your mind as well. Secondly, this time I am doing Hypnobabies, which I already talked about a little bit, but it is absolutely just a preparation of your mind. I completely believe that your mind controls your body to a very large extent. That is what Hypnobabies is about, is harnessing the power of your mind in order for your body to have a more pleasant birthing experience. Now, if you're watching this and you've already done Hypnobabies, you'll notice that I'm not using any of the terminology that they use because I'm talking to an audience that is not primarily Hypnobabies, I am assuming. However, they actually have you change a lot of the language around labor and delivery to be words that do not have such a negative connotation. Like instead of contractions, they will have you say waves or pressure waves or birthing waves so that you can start to restore your mind. It's really, and I should have put this in the last section, but it's important to realize that your mind has been conditioned to think about birth in a certain way. And I know not all of you are from the United States, but if you're watching this and you are, it is very likely that you have been conditioned to believe that birth is traumatic, it's scary, it's impossible without an epidural. It is just this outrageously painful, crazy thing where you scream and you're just like nuts, right? We need to recondition our minds leading up to labor and delivery to believe that that is not a normal birthing experience, and that birth can be much more comfortable and even enjoyable than that, and that our bodies are absolutely made to withstand labor. This is one of my favorite affirmations. My contractions cannot be stronger than I am because they are me. Your contractions are working with you, not against you, to birth your child. So knowing all of those things is super important. Scripture memorization was really important for me as well. Reading books with positive stories, which I've already talked about. Stopping negative stories, just refusing to let them in. Even if you hear one, saying to yourself, that is not going to be my story. Like convincing yourself that you are going to have a positive birth and that there is no other option. And then replace any fear that you have with affirming statements. My camera just shut off and I'm totally lost on where it was at, but I think I covered prepping your mind. And so the last thing I'm going to talk about is preparing your body for birth. So you want to, I'm sure you've heard this before, stay active during your pregnancy. And I'm not going to tell you exactly how you should do that, but whatever way feels best for you. So that could be walking, it could be prenatal yoga, which I'm a huge fan of, walking and prenatal yoga. It could be doing squats, it could be like etc., swimming, depending on where you're at. but you definitely want to be moving your body as much as possible so that your muscles are staying loose and strong, and that you aren't feeling just like achy and crampy, but that you are feeling loose and ready to go. I also suggest using an exercise ball to sit on in your last trimester. It's really good for baby's positioning, and it's just good to kind of like roll around and open your hips up a little bit. It can actually get the baby to drop during labor and in early labor as well. So an exercise or labor ball is super important to look into as well. You've probably heard this before, but I suggest drinking red raspberry leaf tea at least during your 3rd trimester. Some people start it even sooner. It tones your uterus. It can help to prevent excess bleeding, and it can help to make your contractions more effective and efficient, because it is possible to have contractions that do not dilate you. That is not what you want. You want every single contraction to help with effacement and dilation so that they are effectively getting you closer to your baby. And red raspberry leaf tea helps to prepare your uterus for effective contractions. Along with that, dates. I think it's consuming 8 dates a day. I'll confirm down below. I made date balls and ate them every single day for the last like 6 to 8 weeks of pregnancy, and they are supposed to help to soften your cervix. So go ahead and do that if you are in your last few weeks of pregnancy. I also took a tincture last time called Gentle Birth. I will link it down below. My midwife said, yes, some people do it, some people like it. I haven't decided yet whether I'm going to do it again, but I do think that it helped my labor to progress very quickly. I was able to dilate quickly with Olivia, even though she was my first. And my early labor really did not last that long before we got into active labor, and so some of that could have been from the gentle birth. Maybe a little TMI, but you can also do perineal massage. You can do it yourself or have your partner do it, and it's basically just massaging your perineum, I hope I'm even saying that right, to try to prevent tearing. It did not work all that well for us last time, even though we did do it, because I did have a 2nd-degree tear. But again, that could have been related more to me being swollen from the IV, or just the position in which I was birthing, and the fact that I pushed for 2.5 hours, and it was not an ideal pushing situation. So hopefully I will not have any tearing this time around. And lastly, something I'm doing this time around, which I've heard from a lot of natural mamas, is I'm going to start going to the chiropractor during my 3rd trimester. I have heard that it really helps to prepare your body for labor and to prepare for an easier, more comfortable labor, to see a chiropractor ahead of time. So those are my 6 tips. I'm gonna give you a few bonus tips now as well. 1, learn about breastfeeding if you intend to breastfeed. I know there's already so much other learning that you have to do, so I get it if you don't get there, but if you have the time, I definitely encourage you to learn about breastfeeding, to take a breastfeeding course, to contact a lactation consultant, or just watch YouTube videos of other mamas who have been through it before you give birth. Learn about the shots that your baby is going to receive immediately after birth or in the hospital, and decide whether or not you want them or you want to decline them, etc. But at least know about them and research for yourself so you know exactly what is going to happen to your baby when you're in the hospital. And lastly, kind of to go along with that, learn about all of the different rights that you have and the decisions that you're going to need to make as the birthing mother. Learn about skin to skin time and why it is so important. Learn about declining a bath for your baby. There is no reason to bathe your baby. In fact, the Vernix that is on them is actually very beneficial to just rub into their skin. We did not bathe Olivia for the first week of her life, and honestly, we probably could have waited for longer. There is no reason to bathe your child, so research that as well. Understand that you have a right to be in the room when the infant exam happens. There is no reason why a doctor or nurse should ever take your baby without you being there. My husband went with my daughter into the exam room when she had her infant exam a few hours after birth, and he was with her the entire time. Now, there was on the 2nd night time when we actually did have her stay in the nursery, but I'm not going to do that again, obviously, because I'm going to be at home. but at least you can decide. So know what decisions you want to make about rooming in or having your baby with you or in the nursery, etc. Learn about reasons why you might want to wait to cut the umbilical cord so that the baby gets the full amount of the placenta blood and why that is important for them. There are so many other little decisions you can learn about. There are lots of great accounts. Mommy Labor Nurse is one that comes to mind on Instagram, and I'm sure that there are accounts on YouTube as well where you can learn about all of these little decisions that you're gonna have to make. So go ahead and check out all of the resources that I have listed down below. Don't forget to leave a comment, like, and subscribe. I really appreciate you guys sticking around for this. I hope that this was very informative for you. Go ahead and feel free to ask me any questions you may have or that popped into your mind while you were watching this video, and I will see you guys next time. Bye guys.